This course has two main aims. The first aim is to teach you the language of medicine, and the second aim is to teach you to learn how to reason in 3 dimensions. The body is a 3-dimensional structure, and we need to understand what things lie next to what other things so we can understand the way the body is put together and eventually the way disease processes may affect adjacent organs. So put in a more simple way, we're asking you to learn how to see and feel what you cannot see. This image is an X-ray of the right shoulder. And imagine that you have a patient who has a knife wound or a bullet at the site marked X. The question is this a dangerous position or is this a less dangerous or benign position? So we ask ourselves, what lies at X? And how do the bones help us figure that out? There's a bone that we can identify, the coracoid process. And that helps us because X is right below, and we'll soon learn to use the word inferior to that coracoid process. And we see from the artist's depiction here that X overlies the arteries and veins that supply the upper limb. This is a very dangerous location, and the artist has helped us here by putting the coracoid process in. If you can learn to think about how the body's put together and use what you can see to help you understand what you cannot see, this will be a great advantage to you. We need then to think about a system to identify parts of the body using an unambiguous terminology. The terms forward and behind are confusing because it depends on whether we're standing in front of or behind our patient. We pick the standard position. It's called the anatomic position. We see our drawing here, the individual standing, facing us with the palms out and the thumbs pointed laterally. And using that orientation, we define a plane, a mid-sagittal plane, that divides the body into right and left halves. Things which are closer to the midline are medial. Things which are further away from the midline are lateral. The nose, then, is medial to the shoulder, and the hand is lateral to the shoulder. We need another set of directions to define the 2 other planes. Things which are closer to the head are superior. Things which are further away from the head are inferior. Things which are closer to the back are posterior. Things which are closer to the front are anterior. Sometimes you will hear me use the terms dorsal and ventral as synonyms for posterior and anterior, especially when I'm talking about the nervous system. There are other sets of terms that we use in specific circumstances. The terms proximal represent things which are closer to the midline, and distal is used to describe things which are further away from the midline or from the origin or beginning of something. For the upper limb, we also use the terms radial to describe things which are closer to the thumb side because of the radius, which you'll learn about soon, and the ulnar side, or pinky or little finger side, of the upper limb because of the presence of the ulnar bone. We'll also use periodically the terms superficial and deep to describe structures which are superficial, close to the body's surface, and deep, things which are further away. Because of imaging modalities, it's important for us to also think about sets of planes, which are often used in radiology. There's a plane, or it's rather a series of planes, which divide the body into numerous superior and inferior segments. These planes are called transverse, horizontal, or axial. This is a plane of the CAT scan, the computerized axial tomograph. It's also convenient sometimes to divide the body into anterior and posterior segments. These are done with planes called either coronal or frontal planes. And then lastly, we often divide the body into right and left planes. We describe the mid-sagittal plane as one dividing the body into equal right and left halves. Parasagittal planes are ones which are parallel to the mid-sagittal plane.